The alignment step is a very important step. If you do improper alignment, you are going to still draw the guide in a correct way on the model, but the direction of the implant clinically will be a failure. So this is one of the most important steps to perform. First of all, adjust the ISO surface so that you can see the structures clearly on bone here. And the idea is we are going to place 3 points, the same points on the cone beam CT and on the intraoral scan or the lab scan according to your case. So before inserting the points, let me tell you about some tips and tricks. Be sure always to have the same angle. So if I want to place on this molar a point, don't put the molar from this view on the cone beam CD. You have to get both views the same. This is one. Number two, always before placing the point, check that the cone beam CT has no artifacts in this area. For example, this area of the lower 6 here, upper 6 here, or upper first molar, we have an artifact. I'm not going to use this point. And on the intraoral scan or lab scan, be sure that there is no air bubble. I want to place my point in an intact position. Also, try to place your points in a definite areas. For example, if I'm going to use the canine labial surface here and put a point, I'm not sure where this point is here, okay? I prefer to use a definite point. For example, a cusp tip. For example, this is a definite point. It's a cusp tip, and from the same angle, I can put a cusp tip here. So always try to choose your points. Also, try to be near the edentulous space that you are going to place implants. For example, I don't want to place my points, all of them away from the edentulous areas. So I have to place at least 1 or 2 points in this bounded area near the edentulous space. Finally, try to distribute your points. Do not put all the points on the right side and leave the left side. Always try to put 1 point anterior, 1 point to the right, 1 point to the left to make sure you have a balance in your registration. A final trick, always ask your lab or radiology center, or if you have a cone beam CT, for implant cases, try to separate the teeth from each other. This way, you will guarantee that you will be able to get the most of your CBCT regarding points for registration, cusp tips, and so. If you have the patient in occlusion, you can't see the cusp tips anymore, and this makes your job more difficult. To see the cusp tips, I have a nice trick. You can go here, go to clipping, and go to the axial clipping from the bottom here and clip. This way you can see the cusp tips according to which cusp tip you are using. For example, here I use the clipping. I put my cursor here and zoom. Okay, if you put your cursor the other way, it will zoom on the other tooth. So beware where you put your cursor to zoom. Okay, I will choose this, for example, these 2 buccal cusp of the upper first molar here. I will put 1 point. I will just remove the clipping. I will go to the upper central incisor. I will put a point here. Remember, the points are different in color. This one was red, the other one was green, so that you don't mix the colors or put them in a different order. And sure, I want to put a point here near the edentulous space. I will use the cusp tip of the upper left first molar here. I have to place the points here at the same order. So which is better, to place point on the cone beam followed by a point on the scan, or place all the points on the cone beam like I did? No, the best is to place 1 point at the cone beam, 1 point at the scan. to be able to see and make sure that the angle is the correct angle. So here I placed it from occlusal. It was a distobuccal cusp, I remember. Okay, so I placed the same point here. Upper central incisor, 1 point, and I placed the other point at the cusp tip here. I can place it. If I want to clear the markers, I can just delete them from here. If I want to load aligned object from a file, I can load it from here. I'll just click next. And here comes the step of verification. You have to verify. It's not like just you click and go on. You have to verify. You can go through the 2D cuts and see, for example, here, it's not a perfect match. As you can see, there is a small space. A small space in the registration means a small space in the implant position. And this will be a very big problem when in surgery you may perforate the bone and you may it may be a disaster for you and for the patient. You may need bone grafting, you may injure a vital structure. Take care for this exact specific registration step. It's very important. So here you can edit mesh or mark feature regions. If you want to edit mesh, for example, let me show you. I can edit the mesh here. Okay. I can cut the unwanted areas from the CBCT to make sure that the other areas are not interfering during registration. So you can select straight through or select one surface. One surface means you only will cut the buccal surface, leave the lingual, for example. Or select surface by click. I'll show you. For example, here, I will delete this one. Let me guess. There is an intersection here, so I will just remove it. This intersection. Okay. It's a small one. And I will delete it. But I had a hole here in my tooth. I can close holes. As you can see, I can increase the hole diameter, close holes. I will delete. I will go here, I will just highlight it, and then I will close holes. Okay, I closed the hole here. Okay. Now I can select this surface. I will just click on select by click on surface. I will just choose this option and click this one. I will choose invert and I will delete. Now I only have this part to be registered. Also, I have here an area of an artifact. It's very obvious. So I will remove this area. I will just select straight through and remove it. It's a big artifact. They may alter registration, and I will delete. Now I have a one big hole. No, I can undo. None. I will cut it more carefully this time. Okay. And I will delete, inspect. Okay. And then I will highlight it again. I will choose close holes. The artifact is less. It's minimal. Okay. It's accepted and I will click OK. Still, I did not change my registration. It's still there is a gap here. So I will choose mark feature regions. It's another step for accurate registration. Okay, in this step, you just mark the areas on the model or on the intraoral scan that you are sure you will find it in the cone beam CT. For example, as you can see in front of you, this area is bone, and this area, this is not bone, this is gingiva. If I mark this area, you will not get an accurate registration because the cone beam CT does not have a gingiva. So if you look here, you will find the teeth, and you will find the same teeth on CBCT. So I will mark the teeth that I want to. I will mark the teeth that I want to use for registration on the optical scan. Okay, let me mark those teeth. Don't mark the gingiva. It will give you inaccurate scanning, inaccurate registration. You don't need to mark all of them. I just need also to mark the areas near the edentulous area. This is very important. These areas are very important because for registration. Okay, I can mark also on the other side. Mark from the lingual too for better accuracy. If you want to remove this part, you can just press Control, Shift, I'm sorry, you can press Shift and remove them. Okay. And just click Next and wait for the registration again. You see, this is the color map of the accuracy of registration. Blue means it's good, green means it's moderate, yellow it's less accurate, and of course red is not accurate. Of course we get the gingiva in red because we don't have gingiva on the cone beam CT, so this is normal that it's not an accurate registration, but at the teeth area which matters, you can see it's almost all blue. Let's check the registration manually. We can scroll here. No more gaps. No more gaps, almost no more gaps, and this is an accepted registration, and from there we can move on to the next step for implant planning. So we have two options here: continue with acceptable alignment, meaning that the software will not allow you to go to the next step unless the registration is accurate, or continue without acceptable alignment, and this means that the software is not responsible about the registration. If you continue this way, you are responsible for any errors that's going to happen. We have here discard alignment if you want to start over from the beginning. I will just press continue with acceptable alignment. Also, we have here a manual alignment. If you want to change the alignment to manual, and you can accept and evaluate, you can rotate the CT and object, you can move the CT alignment object, and so on. You can do it in very difficult cases where the software is not able to register anymore. Let's try. As you can see, of course, this is not accurate at all. You can adjust it manual, okay, and this is not accurate. Sometimes the X-ray or the CBCT has huge artifacts and you have to align it manually, but of course this is not very accurate. I don't recommend you to do it unless you are you are expert and trained and do this a lot, and also you have a skill to do this. I will just undo. I will go back to evaluation. Before proceeding to the next step, I have to check the alignment. No gaps. Anterior and posterior, by the way, not just anterior. Okay, looks good. And then continue with acceptable alignment.